Hello everybody, my name is Dr. Aruna Varsani. Now we are going to talk about FGM. Not that I practice or my tribe practice. This is something practiced done by multiple tribes. I did a lot of study online. I did also hear people's thought. I will now share my own experience what's happening on the ground because I physically go there when I go and give pads. If we do online or we do any learning by book, then we have a law in Kenya that you cannot practice. In my learning, this is what I used to label it, that you cannot make a decision for someone on the borders of Kenya by sitting into this office at your desk. You have to be on the ground. But respected the law is there. I'm sure there is a lot of studies and investigation has been done already. It became very vital and important for me to share right now what I have experienced on the ground. The FGMs are normally practices done by tribally, and they still do it. As I said earlier, I go to the different counties, and every counties have different beliefs and practices. Let's talk about the area where I have seen FGMs been practiced a lot. It's one of the border area where I still today I see that they do practice on FGM. And let's also talk about how it was done. It's not only FGM. There's a lot happens around this topic. So let's say if a girl has to go through FGM practice, a family normally will invite their neighbors. If they can afford, they'll slaughter a cow, cook meal together, dance together in some area, spend whole day together. Practice of FGM happens. I hope you're understanding what I'm trying to say. At this point, FGM is not only a cut. It's lots more psychologically happening with family. So generally what happens when they want to practice for their own daughters for FGM, they do the announcement in the neighbors. They invite their neighbors and families to come home and celebrate. When you are celebrating something, you are happy, you are light-minded. You like to know the person, you like to know the family, you like to know the people around you, isn't it? And why family is important, why neighbors are important in this practice? Because psychologically also every human needs other human. When you invite your neighbors, you know who they are. When you celebrate something, then one day when they are celebrating any other occasion, whatever their practices are, they will also invite. Now, when there is a hard time, at least you know your neighbors. You go and run to them and ask for help. The moment you have put the law of saying do not practice FGM, we need to have also multiple dialogues with the people who practice. Only law cannot help. The celebration is important. Either we should have the dialogue with the family and say you are allowed to celebrate. What you don't do is only a cut. But because there is no enough education, it's our duty to now have a multiple dialogue with them. My experience is also, I have come across where it's been practiced to the younger girls. Before, it used to be an age of about 12 to 13 years old girl who used to go through this cut. She had enough voice to share with the parents, to the lady who come and practice, that I am in a pain. Go slow. I am in this. Or I don't want to do it. Since we have enforced on a law that it's illegal to do the practice, the family have now started doing FGM practice to the younger girls, 7 to 8 years old girl, who does not know what they are going through, who cannot explain how the pain is. Plus, family have now started practicing in an isolation area. They don't invite neighbors, there is no celebration, there is no conversation about it. They are more scared now when they do practice this, because they feel that the moment we're going to announce to our neighbor, to our family, they're going to report to the police station. It's a correct way actually to inform the police because it's wrong. But did we think about what the family is going through? They have a social pressure. They have also community pressure. These families are more vulnerable because there's one side someone is saying yes, you can practice, where the other side they're not welcoming the girl who is not going through the cut. What's happening nowadays is family have also started practicing. They make sure families are not watching them, they have not been notified, there's no one is noticing what's happening. They practice everything, and then if a girl have excess bleeding, because these practices are done sometimes at night, sometimes sun is setting when people are not around. When she has excess bleeding, the same parents are scared to take a daughter to hospital. You know why? because if they take that daughter to hospital, a hospital will now report to the police. So they are scared. So when they are scared, they normally leave daughter the way she is. And this is where we hear a lot of incident about she had excess bleeding and she faced 1 or 2 health challenge, or sometimes even they die because there's no help. They can't even ask help when if it goes wrong. In many borders, I will especially speak about Tanzania border, because we have a law in Kenya, the families are going into other countries and practice this. Leave their daughters there after practicing. So the families are broken. There is no value to family member. Are we really helping by enforcing these laws, or are we really looking at our own interest here? There are more orphans on those borders of Kenya because of these practices have been enforced by law to stop. Please, there is many area also, it's done unprofessionally, because there is that one lady who goes and practice every house. In some practices, once they have a cut, they have to stitch back that private area. And when they're stitching back, because it's not done by a professional person or a doctor, there's no measurement how much to stitch that area. So our girls are also going through urine infection disease. You know why? Because when they stitch back, there is no enough room for urine to come out. Now, when you face urine infection, then there is a fever. You also miss out on school because you are not well. All these things. This is not the topic I normally discuss on the ground, but I do receive all this information. My tribe don't practice, but I learn by the book, by the people who are talking around, what exactly the practices are. So I want to share my few learnings and leave this conversation open because I need everybody's input here. Number 1, should we have more professional doctor to practice this on the ground, so at least our girls are safe? Do you think we need to have a multiple dialogues with the community who we are enforcing this law on? If you stop FGM, you're not going to stop to know your neighbors. You can still celebrate the adulthood of your daughters, especially the families which are broken. How do we bring this family together, bring the value of those family? I'm talking about both genders now. If you don't value your family member, are we really bringing values together by enforcing? I leave it to you. Share with me your thoughts here, because every time when I see, when I learn, when I hear, it opens up a lot of other questions in my mind. Are we really helping community, or we are breaking those families by saying stop? Thank you.